Chronic illness stresses families, especially when uncontrolled. This often impacts the ability of the child to attend school and participate in other important normal activities, like playing with friends or being on sports teams. Children with chronic illnesses often struggle with mood changes, body image issues, and the disruption of normal life due to treatments. They experience more social and emotional difficulties. This impacts school and relationships, and are more prone to depression, anxiety, and low self-esteem. They may also have school avoidance, separation anxiety, difficulty keeping up with peers, and more somatic symptoms like unexplained stomachaches or headaches. This can all impact the entire family. Parents often feel helpless and stuck about what to do when their child has chronic symptoms and feel unable to attend school. They worry about their child's pain, if they themselves will be able to work that day, and how to manage the situations with school. Parent mental health is crucial, as it's linked to child well-being. Parental stress impacts their interactions with their children and their ability to model healthy coping. Caregivers of children with chronic illness can often feel a sense of helplessness. This makes problem-solving and everyday scenarios even more difficult. A good way to improve your sense of well-being is to take small breaks to calm your body and nervous system when you feel overwhelmed or worried. You need to help yourself calm down in order to help coach your child through hard situations. If you are not calm, it will be hard for your child to learn ways to feel calmer. Box breathing is a simple but powerful relaxation technique that can help return your breathing pattern to a relaxed rhythm. It can clear and calm your mind, improving your focus. It is reported to be used by the Navy SEALs. Box breathing consists of 4 simple steps. Picture your breathing going around a box. Each step lasts 4 seconds long. Step 1 is to fill your lungs by breathing in 4 seconds. Step 2 is to hold your breath for another 4 seconds. Step 3 is to release your breath and breathe out for 4 more seconds. Step 4 is to hold your breath for another 4 seconds. You can repeat this series until you feel calm again. Let's watch an example of this. Sophia's daughter, Camila, has recently gotten sick. She has been showing side effects due to the medicine she was prescribed. These side effects include hyperirritability, as well as being easily agitated and frustrated. Camila's quickness to anger makes Sophia extremely nervous. She can feel her heart racing, her palms get sweaty, and she feels stressed. But then she remembers the box breathing exercise she has been practicing to help her feel more calm. Sophia takes a moment to control her breath. She remembers to picture her breathing going around a box. For 4 seconds each, she takes a breath in, holds, breathes out, and holds. She does this until she grounds herself and thinks of a solution for her outburst. One idea she has is to distract Camila. Sophia decides to take her to do one of her favorite activities. Sophia and Camila go to the park to relax and get some fresh air. Sophia also decides to let Camila's practitioner know about the recent mood changes. That way, they can find a solution for her recent mood swings and behavioral changes together. She also talks about the difficulties with his family and friends and asks for their support. Box breathing is also a great technique to teach to your child and practice together. There are many different techniques similar to box breathing to help you ground yourself when you are having overwhelming feelings as a caregiver. Anxiety symptoms can present both physically and cognitively. Physical symptoms include nausea, sweating, and increased breath rate. Cognitive symptoms of anxiety are often increased irritability, mind racing, and excessive worry. When a situation is difficult, you can use grounding techniques to adjust your negative feelings about the current situation into positive feelings or a sense of acceptance for your current state. A grounding technique you can use when you are experiencing anxiety is the 5, 4, 3, 2, 1 rule. This grounding technique is a 5-sense exercise that can distract you from anxious and spiraling thoughts. To shift away from these negative thoughts and adjust back to present thinking, you focus on 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Jorge, Camila's dad, and Camila are out on a walk. Isabella begins to cry about her constant visits to the doctor. The more she cries, the more Jorge's thoughts begin to spiral. He thinks, I am a bad parent and there's nothing I can do to help her. Jorge also notices some physical symptoms of anxiety. His shoulders begin to tense up, his heart starts to race, and he begins to sweat. This is an important moment for Jorge to acknowledge how he feels. He gives himself 30 seconds to a minute to practice the following grounding technique to model appropriate reactivity. Jorge knows he has to calm down to help Camila. This is an important moment to recognize that your anxious thoughts are becoming overwhelming. This is a good time to use the 5, 4, 3, 2, 1 exercise. Start with 5 things you can see. This will help bring yourself back to the present. Look around you and focus on 5 objects. Name each of them in your head. Then observe the size, shape, and color of each object in its environment. So while Camila is having a moment of distress, Jorge looks for 5 things he can see. Mentally, he labels the objects. He sees a baseball, a squirrel, a pigeon, a park bench, and a tree. Jorge notices the baseball is white, the squirrel is fluffy, the pigeon is gray, the park bench is still, and the tree is large. Continue to narrow down your anxious thoughts through the next step of this grounding method. Find 4 things around you that you can touch. Notice how the things around you feel on your skin. Notice if it is soft or rough, hot or cold. Now that Jorge has found 5 things to see, he will look for 4 things to touch. He feels his jeans on his legs, the sun on his head, his jacket on his arms, and the breeze on his skin. Once you have found 5 things you can see, and 4 things you can feel, step 3 is to find 3 things you can hear. If it helps, you can close your eyes and focus on the surrounding sounds. Isolate the sounds you chose and listen to them for a moment. Try to turn off the anxious thoughts filling your mind and allow for the sounds around you to fill your head instead. It is important to recognize which sounds bring you comfort versus sounds that elevate your stress levels. If it is within your ability, try to lower or move away from irritating noises. Jorge listens around him. He focuses all of his attention to 3 sounds. He hears birds chirping, children playing, and a cat meowing. For a moment, he lets these sounds fill his mind. You are at the second to last step of the 5, 4, 3, 2, 1 method. Look for 2 things to smell. The sense of smell can be an all-encompassing sense. Smell can invoke emotions and memories. Smell can be something that you either notice around you, such as a nearby restaurant. You can also choose a smell that is known to elicit calm and positive feelings, such as a lavender essential oil or candle. Jorge is beginning to feel much more relaxed as he is almost to the end of this grounding technique. He notices the smells around him in the park. He smells the freshly cut grass near him and the smell of a nearby hot dog stand. They both invoke happy memories, and he lets those thoughts fill his mind for a moment. Now you are on the final step of this grounding method. You have narrowed yourself down to 1 thought. Focus on 1 thing you can taste. Depending where you are, you can take a bite of food or a sip of your drink. Focus on the flavor, the temperature, and the texture. If there is nothing around you to taste, you can think about the way the inside of your mouth tastes. Jorge is feeling much more relaxed now that he has narrowed down all of his thoughts onto 1 thing. He takes a sip of his coffee and thinks about the taste of this. He notices that it is warm and comforting. It leaves that taste in his mouth for a long time. Following this grounding technique, you should have a calm and clear mind. You are now in a better headspace to solve the problem at hand. Now you can calmly have a discussion with your child or come up with a solution to the problem without anxious thoughts clouding your decisions. At first Jorge was angry and anxious about his daughter being upset, but now that he has finished the 5, 4, 3, 2, 1 technique, He is able to calmly have a conversation with his daughter. Jorge decides to ask his daughter what is wrong, to get to the bottom of her feelings.
I'm sorry you feel upset right now. Can you help me understand why you feel this way? I just want to help you feel better.
Sometimes when my stomach starts to hurt, it makes me feel sad and nervous. I am worried that no one will believe me.
Thank you for telling me that. You can always tell me when you don't feel good. I want to help you, and it is important for me to know when you are in pain. We will work together as a family to make a coping menu filled with coping skills to help you for when you feel like this. Also, we can make sure to tell your doctor about these bad feelings and work to make you feel better. I notice when my body and mind are calm, I am now able to effectively help Isabella work through her feelings of worry.
It is important to note that before Jorge began the grounding exercise, he noticed that his feelings were beginning to spiral out of control, and in order to help Isabella, he needed to calm himself first. This behavioral strategy is called cognitive reframing. Jorge knows that he needs to calm down to help Isabella calm down. This reframes his behavior from unhelpful to helpful. The more you practice these grounding techniques, the easier they are to use in stressful situations. This is important for managing the stress that comes with being a caregiver to a child with chronic illness. Grounding techniques will help improve your day-to-day life along with your child's. Let's review what calming practices we learned in this video. The first calming exercise we practiced was boxed breathing. It is important to practice boxed breathing on a day-to-day basis so it comes to you naturally when you are facing anxiety. Remember, to do boxed breathing, you breathe in for 4 seconds, hold your breath for another 4, breathe out for 4 seconds, hold your breath for 4 seconds, and repeat until you feel more relaxed. The next coping skill we practiced is the 5, 4, 3, 2, 1 technique, which involves all 5 senses. You focus on 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. When your thoughts are becoming overwhelming, this technique helps bring you back into the present moment. Watching your child suffer from chronic symptoms can increase anxiety and stress for the caregiver and family. When your child is struggling to cope with their symptoms or feelings towards their chronic disease, it is easy to become overwhelmed by your own anxious thoughts. These techniques, and others like them, can help you ground yourself when your thoughts take over. This can help you make the best decisions for you and your child in a proper headspace. The more you practice these techniques, the quicker you will be able to ground yourself and take control of the situation. Thanks for watching and learning with us. We hope this is helpful to you and your family. Talk to your provider with any questions.